Good morning, everyone. Thank you very much for having me here today. Probably you're just gonna look at this first slide and ask yourself who this guy is. You know, this surname really doesn't sound very Irish. I'm not from Ireland, but I've been living in Ireland for the last 10 years. I graduated in Poland, in Krakow, and then I moved over here to Ireland 10 years ago. And since then, I've been working with MS Ireland in Galway. So I was asked to present today about the models of physio services and positive outcomes for people with MS. And I'm going to just base this presentation on my own work in Galway. Very quickly, I'm just going to remind you some information about MS, you know, and things like that, and then I'm going to move to model of service and then service outcomes. So you probably all know there are an estimated 9,000 people in Ireland living with MS. And we know from our recent report published in 2016, Societal Cost of Multiple Sclerosis, that direct and indirect cost of MS to the state is around 429 million euro a year. We also know that from this report that that report showed that the estimate total costs attributed to MS are around 48,000 euro per person per year. It was also highlighted in that report that as disability severity progresses, the cost increase very quickly, and for mild disability, MS costs around 35,000 euro per person, and when we move to people who have severe disability, we end up with around 100,000 euro a year. And in 2017, MS Ireland published another report, and that was the multiple sclerosis and employment facts and figures. And that follow-up study found that increasing disability is associated with considerable reduction in quality of life. The study estimated up to 90 million per year can be saved by preventing or delaying the unnecessary accumulation of disability in MS. And I think one of the way of preventing increasing disability can be actually by providing treatment for people with MS, like a physiotherapy treatment. We also know that National Institute of Clinical Excellence guidelines for management of MS stated that the number one key priority is that the specialist neurological and neurological rehabilitation services should be available to every person with MS. There's also evidence that physiotherapy reduces number of hospital admissions and reduces length of stay of those people with MS admitted. And probably everyone by now know about the benefits of exercise and physical activity for people with MS. There is very strong evidence that there are benefits of exercise in MS. Both systematic reviews and meta-analysis reported positive improvements in fatigue, in strength, balance, walking impairments, quality of life, or we know that exercise can actually lower risk of relapses in people with MS. And unfortunately, due to very busy schedule of my colleagues working in HSC, they do not have really capacity to offer frequency and intensity of exercise for people with MS as these people require. I know that you are very, very busy and you have other cases or other conditions that you need to treat. So MS Ireland developed a model of physiotherapy service to augment HSC service, and we have offered that exercise programs to people with MS over the last 11 years. And our model is based on four main principles, or pillars if you want to call it like that. We have a specialist physiotherapist in neurology who leads the service. We have a very unique, innovative physiotherapy assistant service. We use technology to augment rehabilitation and make it more accessible for people. And we have very strong collaboration with University of Limerick, with the physiotherapy department at UL. We have a specialist neurophysiotherapist with a PhD in MS area, and his main clinical responsibility is to assess, of course, provide assessment for people with MS. And based on that assessment, people are either allocated to exercises groups, or they have more individual treatment, or they may receive a program, a home program that they actually can practice at home, or they may get a program to practice in the gym. They can also avail of the home visits that are usually provided, and an exercise program is delivered by physiotherapy assistants. I will be talking about physiotherapy assistants a little bit later. We also teach physiotherapy assistant course. It's very innovative, very unique situation, because we can train people and then they stay on our service and they deliver exercises for people either in our center, or they go and do the exercises and practice exercise with people in their own houses. We also, since last year, we are having students coming for the placement to our center in Galway. We also welcome students from different countries, and they coming over for through Erasmus program, for example, to stay over 2 months or 3 months in our clinic, and they provide intensive rehab for people with MS. These people are physios qualified in different countries, but they doing like a master degree, or they doing PhD, and they want some external experience, some experience in different countries. We also run FES clinic, functional electrical stimulation clinic. It's a very new project that we do in Galway. Since last year, we are seeing people for clinical trial. We got ethical approval from University of Limerick to run a 12-week program with people with MS, using people who have a foot drop, and they practice exercises with us. I'll be talking about this a little bit later. We receive referrals from HSC, colleagues from MS Nurse, from physios, and also we have self-referrals patients coming to us. We can say that our maximum waiting list is 1 week, so we can see people very, very quickly. We use, of course, probably well-known principles of treatment, like we believe in neuroplasticity, we have a patient-centered approach, we try to use task-oriented approach and functional exercises, and we have very strong link with evidence-based practice. I'd like to talk a little bit about physiotherapy assistant service. So this is a service that we've been running since 2011, and this is through community employment project. So people who are unemployed or have been unemployed for 1 year can actually avail of this service. So we interview these people, and if they have interest in healthcare, they can work with us. They receiving training in physiotherapy assistant course, through physiotherapy assistant course. So this is a 12-week course split into six sessions theory and 6 sessions of practical. And after the completion of this course, they are awarded FITAC Level 5 Physiotherapy Assistant Award. So it's recognized, and after finishing this training, they actually can go and work in HSC, can work in private or public hospitals. Today, we trained up to a total of 82 physiotherapy assistants, and out of these 82, 38 actually are on our community employment project. The rest of people actually were from nursing homes, were from primary care, from public hospitals or private hospitals, who completed the course and went back to work in their own workplaces. We know that the CE project has proven to be an asset to MS Society, and with the participants on the project, we have been able to provide physiotherapy to our clients in the Western region on a regular basis. The physiotherapy assistants are supervised directly by either MS Physio or my colleagues in HSC. And they maintain reports on each physio session, and they report back to CEP coordinator and a supervising physiotherapist. What is really interesting that from January to June 2017 this year, they delivered 858 hours of one-to-one intervention with our clients. And all these programs are designed by physios. They don't come up with any exercises themselves. They're supervised by physio. The program is designed by physio. They only deliver this program either in patient houses or in our center. And these are kind of a couple of pictures, photos from our work in Galway, when these people are actually helping our patients to walk, and providing exercises in our center. Another kind of principle of our model is collaboration with University of Limerick. And MS Ireland have been in partnership with University of Limerick and physiotherapy department since 2008. And as a part of our MS World Day celebration in 2011, MS Ireland and the University of Limerick signed a memorandum of understanding. This formal partnership outlined ways in which the various academic institutions could focus their research on MS. And probably most of you recognize the name of Professor Susan Coote. So she is the main researcher, the main physio, and she has a huge interest in MS. She has run a big trial called Getting the Balance Right project. I presume most of you have heard about this in 2008. And very recently, we worked with Susan on a Step It Up project that started in 2014. And the results of these projects, we have published many papers, both from the Getting the Balance Right project, from different projects, and also very recently, this is the recent protocol that we have actually this study reviewed and accepted for publication. That's the randomized controlled trial of an exercise plus behavior change intervention in people with multiple sclerosis, the Step It Up program. Now, the next principle of our model is the use of technology. We are in very unique position to offer treatments that use technology as an adjunct to rehab, such as whole body vibration treatment or FES assessment treatment for people with MS. At the moment, we have ethical approval to conduct a series of case studies looking at the effectiveness of using FES, so functional electrostimulation, for people with MS. We know that from literature that FES is beneficial and people can improve when they have it on the leg or when they wearing for 8 weeks. But what we don't know, how long does the effect last if they take it off from the leg. So this is what we're trying to do, trying to establish now through this clinical trial. And results of these studies, again, of this project, we published results of the whole body vibration platform. We published also results of the FES, and currently, like I said, we have ethical approval to conduct a study of 12 weeks of functional electrostimulation for a correction of a foot drop and muscle strength, sensation, and other clinical variables in people with multiple sclerosis. Very recently, we've been engaged in in exploring some opportunities and some potential improvements using exoskeleton bionic suits. So people from Galway branch, members of Galway branch, myself and AccuScience, and a person called Jerry McCabe, we're trying to find out if the exoskeleton suit is in any way beneficial for people with MS. It's just very exploratory. We're not doing any study with that. We're just trying to find out if it's something that may actually work for people with MS. And also we collaborated with Spinal Injuries Ireland, and we tried to kind of combine our strength and try to work together to see if this exoskeleton suit can be available for people with MS and spinal cord injury stroke in Galway in the next future. In relation to service outcome, On average, MS Island physiotherapy service in the Western Regional Office delivers 60 hours of intervention and seeing 140 patients every week. This is, of course, not individual kind of clients on one-to-one. It's also through exercises classes. So we run 3 exercise classes in Galway every Monday. Then we run classes in Tuam, in Ballinasloe, in Clifden, in Loughrea, Bog Roscommon, and other places. And these classes, all participants or people with MS are priorly assessed by chartered physio before they enter the classes. And then we provide physiotherapy assistance to deliver the program within these classes. We provide group sessions, individual sessions in MS, in MS Center, also inpatient house. What is very unique about our service is that we run classes continuously in Galway. So there is no break. There's only break for Christmas, and there is only break for Easter, to be honest with you. And the classes, it's not like we have 10-week blocks. We just run them from January to December with these kind of 2 breaks only. We have this facility, we have this capacity to do it. So we also provide regular assessments and follow-ups to our patients. And just to give you some examples how it works on outcome measures. So we use outcome measures to assess how the intervention, if the intervention works. And we can say this is a time upon go test. The time 1 and time 2, this is 8-week period, so people were exercising for 8 weeks, and you can see there was a reduction in time to perform time upon go test. It was 2.5 seconds better after 8 weeks of intervention. However, when we stopped that intervention for another 4 weeks, people actually got worsened. So without intervention, again, the time upon go test showed that they walked slower. This is time up and go cognitive, and again you can see that there is decrease in time needed for this test to be completed, again by 2 seconds 53 after 8 weeks of intervention. But again, when we stopped intervention, people, that was the break over Christmas. When we stop over Christmas or when we stop over Easter, mainly that was a Christmas period, people actually they get worse, after that break. And we have another outcome measure, 5 times sit to stand. So this is a functional lower limb muscle strength measure. And you can also see that people were able to perform that test much quicker after 8 weeks of intervention in comparison to starting point. So it was the mean for the baseline was 17 seconds, 0.1, and after intervention it was 13.4 seconds. So there was improvement of 3.6 seconds after 8 weeks of intervention. But again, when we stopped exercising, people again got worsened again. This is a very interesting slide because this is when we have physios from different countries coming for the placement over summer. So these people, then we offer people very intense rehab. So we have regular classes, but we also ask people if they want to have more exercises, more sessions within a week. And we looked at how the frequency affects the outcome. And you can see that the first regular versus intensive rehab, people improved after receiving 1 session a week, and they improved by 5% after 8 weeks of intervention. However, when they had 2 to 3 sessions, more than 1, 2 to 3 sessions a week, they improved by 26% more. So frequency actually plays an important role. So if they can have 3 sessions a week, they can improve more. And key message to take home is that we provide a very unique model of physiotherapy based on clinical specialist neurophysiotherapists with a PhD in MS area, with extensive clinical knowledge to lead the service. We have an innovative and integrated physio assistant program. We have the facilities, and we have links with our primary care physio services, and we have a continuous service we know that this service leads to improvement in patient condition, whereas breaks in exercises leads to a deterioration. And I'd like to here thank you all my colleagues, staff in the West Region Office, my physiotherapy assistants, and I think that they are very valuable, very, very important part of the team. Without them, I don't think we will be able to deliver that efficient service. Colleagues in UL, HGC, primary hospital physios, and of course people with MS. Thank you very much.